A 54-year-old gentleman came to me with severe leg pain and numbness that had been there for years. He had a slip disc and spinal stenosis. But instead of seeing a specialist and take the complete guidance or advice, he believed in a common myth: spine surgery causes paralysis. He delayed the surgery, tried everything else from massages to home remedies, and by the time he returned, it was too late. The nerve was damaged and progressed. We did the surgery to relieve the pain and at least we made him sit, but he never regained full strength in the limbs. He lost the strength in the legs and could not walk normally forever, and he needed bone and bladder care for rest of the life. This could not have happened. Hello everyone, welcome. I am Dr. Ganeshv, Senior Consultant Neurosurgeon. Today, let us clear the air around one of the most misunderstood medical topics, that is spine surgery. Many people suffer silently with the back and neck pain because of fear. Fear that spine surgery will leave them worse off. But the truth is, modern spine surgery is safe, faster, and more effective than ever before. So, in next 10 minutes, let us bust 5 most common myths of spine surgery with the facts, logic, and hope. Myth 1. Spine surgery always leads to paralysis. This is the biggest and most harmful myth. The fear of paralysis stops many patients from getting the help actually they need. But here is the truth. Spine surgery today is incredibly advanced. With the tools like high resolution MRI, microscope, and experienced neurosurgeons can perform procedures with millimeter precision. In reality, the risk of paralysis is extremely low, especially in elective surgeries like discectomy, TLIF, that is transforaminal lumbar interbody fusion, and ACDF, anterior cervical discectomy and fusion. And guess what? Many patients regain lost movements and prevent further nerve damage, and thanks to timely spine surgery. So, spine surgery does not paralyze the people, but it actually protects their nerves from further injury or damage. Myth 2. You should avoid spine surgery at all costs. Many people try to manage back, neck pain with medications, physiotherapy, and injections, and rightly so. That is the first step. But sometimes non-surgical treatments don't work. In cases of severe disc prolapse, spinal stenosis, spondylolisthesis, delaying surgery can lead to permanent nerve damage, including foot drop, bladder dysfunction, and chronic weakness. Spine surgery is not something to be feared. It is something to be done wisely when it is needed. It is not the last resort, but it is the right tool for the right patient and the right time. Myth 3. After spine surgery, you can never walk normally again. This is one of the misconceptions. In fact, most of my patients walk on the same day or next day after minimally invasive surgery, even with conventional surgeries. Take microscopic discectomy or MLD or TLIF procedures. We use microscopes, small incisions, and gentle handling of the nerves and spinal cord. So, as soon as the pressure on the nerve is released, the patient often says, "Doctor, the leg pain is gone." With proper post-op care, physiotherapy, walking improves, posture improves, and mobility is restored. So, spine surgery helps you to walk better, not worse. Myth 4. All spine surgeries are done with large cuts and long hospital stays. That may be true about 20 years ago, but not today. Today, we use minimally invasive techniques, microscope, drills, advanced CR machines for many more spine surgeries. This means small incisions, microscopic or endoscopic access, only retraction or very less muscle damage, faster recovery. Patients often stay in the hospital for only 1 or 2 days, and many will go back to their desk jobs in 2 to 3 weeks. So, spine surgery doesn't mean big scars, bed rest for months, and it is often quicker than people think. Myth 5. Once you have spine surgery, you always need more and more spine surgeries. Many people say, if I get one spine surgery, I will end up 3 or more later. That is a myth. It's a fear based assumption. The truth is, if the underlying problem is diagnosed neurologically correctly, properly identified and treated, and if patient follows good posture, physiotherapy, and avoid strain, once surgery is done, often enough. In fact, I have seen patients do extremely well for 10 to 15 years post surgery without needing any more surgeries. Yes, there are rare cases of recurrence, but once again depends on the patient's lifestyle, body mechanics, and the problem at the other spinal levels. So, spine surgery doesn't mean lifetime operations. Let me leave you with this note: back pain, neck pain, disc problems, nerve compressions doesn't mean that you have to suffer forever. Spine surgery, when it is done at the right time by right hands, and is safe and life changing. Do not let myths keep you in pain. Consult neurosurgeon or qualified spine surgeon. Get your MRI reviewed and understand your options, because informed decisions can lead to better outcomes. Thank you for watching. If this has helped you clear your doubts, and like, share and subscribe to our channel. Thank you for watching. Have a nice day.